You're going to put the patient's bib on. Next, we're going to give the patient their glasses and instruct them to put them on. Lastly, we're going to have the patient rinse with the mouth rinse for a total of 30 seconds. Patient spit back into the cup, and then we're going to suction it out. And then we'll throw our cup out. And we're going to place our patient into the supine position. Make sure you have your light. You can view the patient's oral cavity. Close. First thing we're going to do is we always do a visual before we palpate anything. So we're going to start by doing a visual inspection of the lips. So first we're going to look at the vermilion border, the vermilion zone, the philtrum, the labial commissures. I'm going to have the patient open. And I'm going to pull the lips back and take a look at my labial frenum on the mandibular, the wet line. Look at my maxillary labial frenum, the commissures. I'm going to retract and look at the buccal mucosa, identifying the parotid papilla and the Stenson's duct on both sides. So make sure you're retracting to get a good visual of both sides, my parotid papilla and the Stenson's duct. Once I've done my visual inspection, I'm going to start palpating. So using bidigital palpation, I'm going to palpate the lips. And then I'm going to move back, palpating the cheeks. Coming around, do the maxillary lip. Make sure you're covering that entire buccal mucosa. So you're going to go up and down in a circular motion. We're going to move to do our visual inspection of our hard palate. Again, always inspect first before you palpate. And we're going to identify our incisive papilla, our palatine rugae, our median palatine raphe, also known as the median palatine suture, looking for the palatine fovea, which this patient does have, the demarcation between the hard and the soft palate. Once I have done my visual inspection, I'm going to do digital palpation, going across the palate in a right to left pattern. This is the best way to be able to identify if the patient has any palatal tori. Once you have done your hard palate, you're going to take a look at the soft palate. Ask the patient to say as you're using the mirror to depress the tongue. You want to make sure they're saying so the back of the throat opens up and you identify the uvula, the anterior, posterior tonsillar pillars, as well as the palatine tonsils, and note if the tonsils are present or not. You will also note if there are any types of tonsillar crypts. Next, we're going to move on to the tongue. So I take my 2x2 gauze, fold it lengthwise, get it wet so it doesn't stick to the patient's tongue. I'm going to ask the patient to open and extend their tongue out as far as they can go. I'm going to grab the tongue, wrapping the gauze around it, pulling it slightly outward and turning it to one side, doing a visual inspection of the full length of the tongue. Have the patient turn towards you to do the same and inspect the other side of the tongue. Once you do that, you're going to do a palpation technique by digital. So from the ventral and the dorsal surface, you're going to palpate, and then digital palpation through the center of the tongue. Ask the patient to lift their tongue for you. Okay, note any lingual varicosities that the patient may have. You're looking at the plica fimbriata, the lingual frenum, the sublingual caruncles, the sublingual folds. You may need to use your mirror to be able to inspect all the way back. Once you have visually inspected and identified all your landmarks, you're going to use 2 fingers under the chin, 1 or 2 fingers intraorally, using upward circular compression to do your palpation. At this time, you're also going to note and look for any mandibular tori, generally in the presence of the mandibular premolars. And you're going to make sure that you document all of your findings as you find them. All right, last we're going to inspect our maxillary tuberosities, our retromolar pads, as well as our alveolar ridges, both arches from the buccal as well as from the lingual side. And I'll repeat the same process on the maxillary arch. Make sure you're adjusting your light if you need to. After I inspect, I'm going to palpate. So you'll palpate the retromolar pads and the alveolar ridge on the mandible, and then you'll do the same thing on the maxillary. Make sure you're doing your documentation of any findings as you discover them. Patient can close, and that concludes our intraoral examination.